Well, thank you, Dr. Isham. And in addition to that, I want to thank the National Academies of Science, Engineering, and Medicine for the opportunity to provide an update on the efforts of HHS related to the development of Healthy People 2030. My colleagues from ODPHP, Carter and Tiffany at the back, the co-chairs and members of the Secretary Advisory Committee on National Health Promotion and Disease Prevention Objectives, and I are all pleased to be here today as the National Academies continue their important work on developing the leading health indicators for Healthy People 2030, which will represent the nation's highest public health priorities. Since the inception of the Healthy People initiatives, the National Academies have played an integral role in the development of national disease prevention and health promotion objectives and the key indicators. If we go all the way back to 1979, the beginning, the first iteration of the Healthy People initiative was titled Healthy People, the Surgeon General's Report on Health Promotion and Disease Prevention, and was released, followed by, in 1980, by the publication of Promoting Health, Preventing Disease, Objectives for the Nation. At the request of the Surgeon General, the Institute of Medicine prepared a book of background documents to accompany the Surgeon General's report. Moving forward, in 1990, the Institute of Medicine published Healthy People 2000, Citizens Chart the Course, which provided input to the development and structure of the national objectives for the second iteration of this initiative, Healthy People 2000. In 1999, the Institute of Medicine published a report on national indicators, also known as the Leading Health Indicators, or LHIs, which were introduced with Healthy People 2010. This was the first decade the Healthy People initiative reflected on the major public health concerns in the United States. The leading health indicators were chosen based on their ability to motivate action, the availability of data to measure their progress, their relevance as broad public health issues, and to facilitate collaboration across sectors at the national, state, and community level to improve the health of the U.S. population. For Healthy People 2020, in response to a request from HHS, the Institute of Medicine established the Committee on Leading Health Indicators to develop and recommend indicators for consideration for the initiative. It was anticipated that the work of the committee would build upon the 1990 IOM report, Leading Health Indicators for Healthy People 2010, and the work of the Committee on the State of the U.S. Health Indicators. The committee developed a consensus letter, Leading Health Indicators for Healthy People 2020. As Healthy People 2020 is coming to an end, the National Academies and its Committee on the Leading Health Indicators continues to be instrumental in the Healthy People development and implementation process. And we know that your insights will prove invaluable in identifying key indicators for the Healthy People 2030 initiative. Throughout the history of this initiative, Healthy People has been increasingly looked to upstream influences on health. The Healthy People objectives and the LHI have continued to evolve and reflect key disease prevention and health promotion issues and use prominent, high-quality national data sources. Additionally, the leading health indicators have become an integral part of communicating key Healthy People messages, particularly in the areas of health disparities, health equity, and the social determinants of health. For example, the first iteration of the initiative contained 2 overarching goals, supported by 15 topic areas and a set of 226 objectives to be monitored and assessed over the decade. Moving forward, Healthy People 2000 included 3 overarching goals, which included language on reducing health disparities and contained 22 topic areas and 319 objectives. Healthy People 2030 was comprised of 2 overarching objectives which strengthened the emphasis on disparities and approximately 1,000 objectives supported by 28 topic areas. Additionally, Healthy People 2010 incorporated 22 leading health indicators across 10 topic areas. This decade, Healthy People 2020 continues to prioritize the elimination of health disparities and places renewed emphasis on achieving health equity and introduce the social determinants of health framework and topic area. It contains 4 overarching goals supported by over 1,200 objectives across 42 topic areas and 26 leading health indicators organized under 12 topic areas. As we look forward to the next decade, the selection of the leading health indicators will continue to reflect key priorities for the Healthy People Initiative. Since the second meeting of the National Academies Committee on Leading Health Indicators in April, the department has continued its efforts preparing the launch of Healthy People 2030. Currently, the department is working to finalize the slate of proposed objectives. That would be core objectives, developmental objectives, and research objectives that were revised based on comments received from the public. During the open public comment period, the department received approximately 5,000 comments on the proposed slate of objectives. In the coming weeks, we anticipate the slate of proposed Healthy People 2030 objectives will be submitted to the HHS Secretary, the departmental clearance, for review and approval. The launch of Healthy People 2030 is anticipated for early 2020. The LHIs for Healthy People 2030 will be released in the year following the launch of Healthy People 2030. The Advisory Committee is also continuing their work on the proposed objectives for 2030. Recently, the Advisory Committee report on the assessment and recommendation for proposed objectives for Healthy People 2030 was submitted to the HHS Secretary for review. The report serves as the 7th report from the committee, and it includes recommendations based on public comment review and assessment of the proposed objectives in light of the Healthy People 2030 framework and committee recommendations. The next meeting of the Advisory Committee will take place on Wednesday, June 26th, from 12 p.m. until 4 p.m. via webinar. During the meeting, the Advisory Committee will review and finalize the prioritization of recommendations from the Implementation Subcommittee, and the Graphic Subcommittee will provide an update on the graphic model for Healthy People 2030 and related recommendations for approval. This will serve as the 14th meeting of the Advisory Committee. Registration information for this meeting is available online at healthypeople.gov, and certainly the public is open to attend. As next steps, the Advisory Committee plans to share the implementation and graphic subcommittee reports with the HHS Secretary following the June meeting, and HHS is preparing and planning for a launch event to kick off Healthy People 2030 in the spring of 2020. As the department continues its work on the development and implementation of Healthy People 2030, including the leading health indicators, we look forward to receiving ongoing input from stakeholders, organizations, and members of the public. Well, again, thank you for your time and your energy and your devotion to this issue. And with that, I'll turn things back to you, Dr. Isham.
Thank you very much, Don. We are doing real well. Should we take some questions at this point? Sure. Let's. If there are questions for Don from the committee, this would be a good time to ask them. Go ahead, Paula.
Thank you very much for that overview. I'm wondering, from your opinion, what's been the most important ways in which the 10-year Healthy People efforts have shaped public health, population health efforts? What's good about this process in general?
You know, I think it's the fact that it really coordinates all resources and sets an agenda across the U.S. Department of Health and Human Services. Certainly, the Center for Disease Control has certain priorities for them that they work on. CMS has others. And the Healthy People Initiative really reflects the goal of the department and what are the public health issues that we would like to track over the next decade moving forward. As it relates to the leading health indicators, I think that's an opportunity for us to distill down what is most important to the nation. It was our former Assistant Secretary, Howard Koh, that suggested we move from 10 leading health indicator topics to 12. And the purpose for that was that we could focus on one leading health indicator topic every month, highlight the best practices, reach out to the communities, allow best practices to be shared across the nation with an eye towards plagiarism at the local level.
Martha?
Thank you for filling us in a bit. As in the last couple of decades, there's been a larger focus on the broader determinants of health. And you sort of talk about how the department has been channeling its energy into the Healthy People Initiative. Lots of people are talking about being more intersectoral, involving different kinds of parts of the government. What's been the work at HHS in terms of reaching out to agriculture, to education, to transportation, to environment, in thinking about Healthy People 2030?
Martha, thanks so much for that question. And that's certainly something that we've approached and that we want to build on as we move from Healthy People 2020 to Healthy People 2030. We feel like that as you go up and down the mall, every one of those buildings contributes to health in some way or another, whether they realize it or not, and sometimes that they don't. High school dropout rates and that being addressed in the Department of Education really has huge downstream health outcomes as it relates to individuals. So we want them at the table. The U.S. Department of Agriculture has partnered with the department and with our office as it relates to the dietary guidelines for Americans and addressing issues such as food insecurity and what is the most healthful diet for the American population. Department of Justice, we've worked in the area of crime prevention and injury and violence. We think that the Department of Interior has a role to play in the great outdoors and encouraging physical activity in the outdoors. Certainly, as it relates to environmental issues, the Environmental Protection Agency needs to be engaged and has been engaged as it relates to air quality and clean drinking water, et cetera. We have made inroads, and if you participate in some of our federal interagency work group calls, you'll see individuals from other departments that participate in those and are part of the implementation plan. Do we need to grow, and we'd like to see more of a presence across the federal family and Healthy People as it relates to the other departments? And I could go on and on. I left out the Department of Transportation and the role that they play. The Department of Housing and Urban Development clearly has a role to play. So yes, we do recognize the importance of carrying the message of Healthy People to those upstream departments that really can help us move the needle on health outcomes.
Don, I have a question about terminology, actually. So, I'm an old guy, this is my 50th year in medicine and health. And was very excited in the 1970s as this was launched, and we really got into thinking about, I was a primary care physician at that point, practicing general internal medicine, but really excited about the emphasis on promotion and thinking about reaching out to people beyond when they were sick, which was sort of the reactive model in the 60s and the 70s of medicine. And now, more recently, having had the opportunity to chair the Roundtable on Population Health and Public Health Practice at the Academies, not currently, but prior to, thinking about those causes of health beyond just healthcare itself. And I noticed that the terminology that we use sometimes in the Healthy People 2030 process is disease prevention and health promotion, or health promotion, disease prevention. I don't know the exact phrase, which seems to me to be a legacy phrase from that transition from reactive medicine to prevention, and now with what we've seen develop in the 90s and the first couple decades of this century, a transition to really fundamentally understanding what causes health. So public health, disease prevention, promotion, focus on health itself. Give us some thoughts on terms of how we might deal with those concepts as they emerge here. I hope I'm not being too obtuse in my question, but it does create a little bit of confusion about where this effort is focused, and I'm wondering what your thoughts are on that.
Right. Well, George, some great questions there, and we could probably talk the next hour and attempt to answer so many of those questions. Certainly, the Healthy People Initiative is always focused on disease prevention and health promotion, and shied away from healthcare delivery issues, although certainly access is one of those social determinants of health that we have attempted to measure and follow over the decade, because we do think it's one component of overall health. I will say, on the number of years that I have worked on the Healthy People Initiative, there has been a march towards recognizing and addressing those upstream factors: housing, environment, food insecurity or food security or insecurity, all those upstream factors that we know have educational level, have such downstream health outcomes. That is something that I think will only grow over time. It has been something that was certainly embraced in the last administration and has been embraced by this one as well. I think many of you have probably heard some of our secretary's remarks that speak directly to the social determinants of health. Although health and health care, our healthcare delivery, are kind of two different realms, in many ways, the other aspect that I've seen happen over the last few years is the bridges being formed between the two. And I hope those bridges will get broader and more prolific as we move forward. There are so many intersections that those two groups can play. As I look at the senior population and focus on something as simple as the clinical preventive services. These individuals are covered, have complete coverage. If once they're past 65, they can get some of the clinical preventive services free of charge, and yet the uptake of those clinical preventive services is abysmally low, and so an area that we need to work on. So yes, we do focus on disease prevention, health promotion. We're trying to build more bridges across the federal family and between healthcare delivery and those of us that focus on prevention.
Could I follow up with a variant on my question, which is now the sort of the relationship and tension between health promotion, disease prevention, and those factors that drive health itself?
Again, for the first time ever, one of our leading health indicator topics in 2010 was the social determinants of health, and we focused on education as one of the things that we followed over the decade, high school education rates. It's certainly one of the more powerful social determinants of health as it relates to downstream health outcomes. That will only continue and be expanded upon as we move into other areas. You probably know that we currently have a IOM committee looking at the social determinants of health and the direction that we're headed, and we hope to build upon that next year, looking in the area of food security, transportation, all the environmental issues, all the social engagement, community engagement, all the things that we know that are important. So there will be a marriage between those upstream factors and many of the prevention initiatives that we have.
Go ahead, Martha.
I'm interested about the data sources that get used, and I don't know if this is for you or for Carter or Tiffany, but are the sources all under HHS control, or are you using data sources like census or things that come from education, agriculture? How widespread are you in finding reliable sources of data that you can track over the decade?
Right. Well, certainly David Wong, who's here with us today, could probably give you a better answer to that question. But as many of you know, we had came to the decision that healthy people needed to be reduced this year in the number of objectives, just from partly from the burden and partly from the focus standpoint. We've been criticized that we were somewhat encyclopedic as it related to health objectives, and so we wanted to make sure that as it related to Healthy People 2030, we had a more condensed but comprehensive list of health objectives. At the outset of that study, or that effort, we created a list of requirements as it related to data sources. It had to be nationally representative, and there was a whole host. And in many ways, it was one of the ways that we determined if an objective would move forward or not. Did it meet the rather rigorous requirements of the National Center for Health Statistics required? Now, there is no perfect data source without question, but we do feel like the new process that we had is going to make sure that the data that is presented is of the highest quality and can be relied upon.
just to clarify, I was asking really whether you went outside the sort of the aegis of NCHS and used other data sets, or whether everything was sort of
No,
filtered
there
through
are some
there.
outside data sources that we do rely on as a part of Healthy People.
Darcy, I know you're on the line. Ebony, are you also on the line? Can they speak or not? Can they just watch? Okay. So Darcy and Ebony, I understand that you can send questions by email, and I'm monitoring my email, but not doing other stuff. As well as Alina will also be monitoring her email. So if you have questions, please communicate those to us, and we'll pass those along to the presenters. So at this point, to move the agenda, we're right on time at 9:30, and I want to express my appreciation to you, Don, one, for engaging us in this very important task, and two, for being with us this morning and on our previous meeting and helping us to understand better what the issues are. So thank you so much.
And thank you for the work you're going to do on behalf of the department.
Great, thank you.